Nanette, what is the most foundational movement you think that everyone should be doing no matter what?
Hip hinge. Why do I have to say this? I feel terrible saying hip hinge.
No,
It's so simple.
But hip hinge, okay, so let's talk about the hip hinge.
Yes.
What are movements that are hip hinge?
Everything.
I was thinking like a bridge.
A bridge. A bridge.
Like RDL.
Okay, let me show you a combination. We got picking something from the floor. We got squat. We got just forward stretching. We got tricep kickbacks, lat pull downs. Like, you can just do a whole workout on a hinge. Like, I can just teach a whole routine on a hip hinge, like arms and everything.
Right.
Rows,
it's so good because now you're in isometric. Well, not the deadlift, but like when you're doing upper body in a hinge position, it's a beautiful isometric.
Work out your posterior chain as you're doing your workout. So
yes.
Hinge is your primary movement. You want to master your hip hinge.
What would you say are the most important things to look for when you're hip hinging?
Please make sure your feet are straight or I just have a heart attack immediately. The first thing I'm going to look down on, ask Malia, is your feet.
It's the first thing I look at. Spine, thoracic spine, and feet. Because why? What does everyone do?
Because a lot of people, many things. So a lot of people will either stand with one foot out, cross a single leg, which leaves their leg deviated out. And they just never correct it.
So why is that bad? Tell me why standing with my right leg, for me, kicked out to the side is a bad habit.
Well, first, let's start with proprioception. Let's start there. So you got to be connected to your feet. You got to know where and how you are standing because they are your bottom scanners. So, and there. But if they're pointed out and they're all deviated, you're not aware of what is going on down there. So we'll start with that. And then you got to be aware of making sure your feet are lined up nice and straight. We're going to put a picture. You want the outer edges of your pinky toe to be in line with the heel, which for some may look a little bit internally pointed, but it's really not. Outer edges of the pinky toe in line with the heel is nice and straight.